And Dr. Dan Tomlinson joins us now to answer some of your medical questions. Thanks for being here tonight.
Great to be here tonight, you bet.
All right, now our first question comes from a viewer who wrote in. She wants to know if there's anything that can be done for female hair loss. She says she's lost hair on her head, noticeably thinner eyebrows, eyelashes, and body hair. Now she says her thyroid has been tested, and that turned out okay.
So basically, she's not really losing hair. What happens is the hair disappears. We go from what's called terminal hair to vellus hair. Our entire body is really covered with vellus hair, the peach fuzz. You look at the back of my head, I used to have terminal hair, now I have vellus hair there. Well, this can happen to women too. Now the eyebrows are a little bit peculiar. She's probably blonde or fair complected, because usually that doesn't happen in people who are brunettes. But let's just talk about hair loss on the head. Wigs are kind of fashionable now, but if you don't want to go with that, you want to get more expensive, there's Bosley. You see those commercials for men, and that's really what they're doing, is they're taking hair from an area of the head where there is terminal hair, and is always going to be terminal hair, and they put it where those vellus hairs have come in. It's pretty expensive, but women do that just like men do, and then of course minoxidil will work. You can't use Propecia because that's a male kind of hormone, but Bosley, wigs, or minoxidil would be my answer.
Okay, and that's a big thing for a woman too who's losing hair. It's kind of a big deal, I'm sure, for men too. Okay, our second question tonight has to do with sinus infections.
Yes.
American Academy of Pediatrics is now saying doctors can wait for nearly 2 weeks before prescribing antibiotics.
Hooray.
So, all right, what are your thoughts on this?
I'm so glad about that. You know, this is a constant battle as to when do we give antibiotics. You know, infections of the sinus always start out viral, but you know, there's this pressure, this tension that we get from patients to give antibiotics as soon as it hits. So you treat viruses with zinc and vitamin C and hydration and treat the symptoms. What we're doing is we're creating superbugs by giving antibiotics. It's the same thing as with the genetically engineered wheat and so forth, and everybody's against that because we're going to create super wheat, you know, and bugs against wheat. Well, we're doing the same thing with people when we treat sinus infections that are viral with antibiotics. So I think when the pediatric folks came out and said that, we all went, yay, all right.
Right, because
it's nice to have some backup when you're just right there with the patient or the patient's mom.
No kidding, and I'm sure it's a relief for parents too.
You bet. Well, it's nice to know that, you know, maybe an antibiotic isn't the only answer, and you know, we're causing problems, and not only for Junior, but for society as a whole.
Exactly. All right. Thanks, Dr. Dan. And Dr. Dan joins us each Monday to answer your medical questions. If you have a question, you may write or email him at the addresses on your screen. You may also post the question on our News 10 Facebook page. We'll be right back with more News 10 at 5.